More than ever, we're being asked to look after our mental health. It's getting more coverage than ever before. But after a new report criticised the crisis care on offer in Norfolk, are our mental health services starting to turn a corner? Hello, good evening. It used to be something that you just didn't talk about. But now, mental health is a fixture in the headlines. In Norfolk, the Norfolk and Suffolk Foundation Trust, who provide our mental health services, was taken out of special measures last year and is now rated as requiring improvement. So progress is being made, despite there still being some problems. But in the last few days, a report from HealthWatch criticised mental health crisis services in the county. So there is a bit of a mixed bag at the moment, but are services here now turning the corner? Joining me to discuss that tonight on the panel are Michael Scott, who's the Chief Executive of the Norfolk and Suffolk NHS Foundation Trust. Also with us, David Powles, the editor of the Eastern Daily Press. Also joining me on the panel is Kimberly Myhill from charity Equal Lives, who was diagnosed with depression 5 years ago, and Tom Oxley from Bamboo Mental Health, who are workplace mental health consultants. A very good evening to all of you. Now, Kimberly, I'll start with you if I can. There's a great deal more publicity now about mental health, talked about an awful lot more in the media. People seem to be more aware of it. You've been through it, you've been on that journey yourself. Do you feel the general public who've not been on that kind of journey have got it? Are they getting it now? Are they understanding it now?
I do think we're definitely at a point where it, like you say, is vastly talked about far more than it ever has been before. I think in my experience though, so I recently did a piece in the paper with Tom, and I got a really, really lovely response from that. I was overwhelmed by the comments that people were making, but the common theme that comes up is, oh, you're very brave. You're so brave for talking about this, and it shouldn't come from a place of bravery or courage that I should be able to say those things. It's to me, it shouldn't be any different to. It should be
an open thing.
Yeah, so I think they are getting it in terms of. Sorry.
I was going to say just to give it some context for people. Your story. You were diagnosed 5 years ago. Mm-hmm. Had it been a long journey to reach that point?
Yeah. I would say that there was a lot of years leading up to my diagnosis, but I didn't realise that was necessarily what was the contributing factor towards my behaviours and symptoms. So it wasn't until I was sort of in my early 20s that somebody encouraged me to go to the doctors, and I thought, oh, perhaps I do need a medical opinion on this. But I think. Oh, sorry, I've lost.
Well, you've made that journey yourself, and things may be starting to change. But Tom, you go into businesses and you're working with companies about how they approach their mental health. Do you feel there's been a step change now?
Yes, certainly the royal family, the London Marathon and Prince Harry and co speaking up about it has generated significant awareness nationally. With that, you've got places like our local paper running many more frequent stories on it and in devoting whole paper to it this week. That's been really interesting. The general awareness is high, but there's still a gap between that general awareness and people in workplaces thinking that it's something that they can do something about. And I'm talking specifically here about HR directors and occupational health teams. So you've got this mass awareness, you want people starting to talk about it, they go to their manager, and the manager's just not ready to have that conversation. They start shaking in their boots, they ignore it, they deny it. Some difficult things are happening, but overall that general awareness is there, so the time is right for that to change in workplaces.
Well, so that's the company side of things, the business side of things, that's the personal and general public side of things. We will look briefly at this HealthWatch report that came out a few days ago. David, can you just run us through what were some of the key bits in that?
Yeah, well, this is a report looking. It's run by HealthWatch, who organisation that have a role to play where they sort of step back and say, look, this needs to be looked at. And they looked at sort of crisis mental health care in Norfolk and raised quite a few points. Raised some concerns with regards to how people felt they'd been treated. People said they felt that they hadn't been kind of cared for as compassionately as maybe they felt they should have been, which surprised me, because in our experience the feedback that we normally get is actually you've got a lot of staff who are trying their hardest and are actually very caring, but they're working in very tough circumstances, which I know we'll come to in a bit. It talked about the kind of confusion, the problems that you maybe have sometimes at A&E. So, you know, A&E services are still not, you know, that's often where people end up as a first resort. But A&E is not really geared up to deal with those people and to kind of sort of get the flow going, and talked about that. One of the really interesting things that I think it talked about, and it's an area that I think gets neglected a bit, is dementia. And this was sort of quite a way down what was quite a lengthy report. But I think that in a place like Norfolk, where we've got an ever-growing population, a lot of people don't see dementia as a sort of symptom of mental ill health, but it is. This is something that we need to be doing a lot of work on, and something we need to be talking about. So it talked a lot there about how you know, people weren't getting as good a service as they should do around dementia, and part of that is because it is an ever-growing problem in a county that is the oldest county.
It was a long report, 147 pages, I think, if I was
and I
correct. But if I can get to Michael, the Care Quality Commission, the watchdog, the people who inspect you, they say there are improvements within the trust, but seeing this report, was it a concern for you, a surprise?
Well, the Care Quality Commission, as you say we are improving. They've been to see us for each of the last 3 years, and what they bring 90 inspectors, so they look at every part of the trust, and they said, yes, we're improving. And their view of the work of our staff, and David's mentioned it, is that their caring was rated as good. So that is in somewhat contradiction to that report. I suppose I would say we need to put that report in context. It's one element of one part of our service. We ask our service users every single week what they think of our services. I've got some comments here, and if you just let me read a couple out. So, the experience I've had with the service over the past few years has only been positive. If it wasn't for the service, I wouldn't be here today. This is the best example of patient-centred care. Really kind but realistic staff. I now feel optimistic about the future. And I've not been selective there. We have pages of these sort of comments. So what I'd say, and really on behalf of our staff, is that they are caring. We are improving. If there's issues around crisis, of course we'll address those. But the overall view, the overall picture, is one of improvement.
Okay, Michael, thank you. Let's hear now from Natasha Devon, who's a prominent mental health campaigner and writer. She was a guest editor for the Eastern Daily Press on Monday as part of their mental health takeover.
We know that it has become more acceptable to talk about your mental health recently, that there's been a lot of campaigning going on, and even the royal family have got involved, and that's a good thing. But what it has done is it's meant that there's been a lot more demand for services at a time when there's a lot less money being spent on public services, and that's left a lot of areas, but particularly Norfolk, struggling to meet that demand.
Now we'll come to you, Michael, about demand that Natasha mentioned there. How high is demand at the moment for you?
Well, it's definitely increasing. We welcome the work of David's paper and this programme in raising awareness. You know, I myself wrote a piece for David about my own family's experience of mental health, and we should all be able to do that, and we should all be able to talk to it. The other side of that coin, as Natasha says, is that people go to their doctors and that demand comes through to us. So demand is absolutely rising. The good news is, in contrast to what Natasha said, is our funding has increased this year. So we've got over £15 million this year for new services in Norfolk and Suffolk.
But is that enough for what you need to be providing?
Well, it's never enough, but £15 million is an awful lot of money, which we've not had historically. So it's very clear that historically mental health has been the Cinderella. It's not had its fair share of funding. We've worked hard and campaigned. Everybody around this table has worked hard on that. And I'm optimistic that now that money has started to come through.
How long do you think that will take, though, Michael? We talk a lot about parity of esteem, and you use the example that you know, hospitals, they get given money depending on how many people they treat. You treat an ever-increasing number of people, but you get the same splodge of money, although you've had more this year, as you point out. How long is it going to take for that balance to be met, do you think? Is it 10, 15, 20 years? Or?
Well, I wouldn't say that long. I mean, I think we've got 5 years of catch-up because, as you say, the NHS funding formula gives to the acute hospitals according to who they see, and we don't benefit in that same way. But I have to say the attention from government, from local commissioners this year has made a difference. And people will see that in new services in Norfolk, the perinatal services, the mother and baby unit, work at A&E. You mentioned people turning up in crisis. We'll have what's called liaison psychiatry at the NNN this year, which should make a real difference.
Oh, David, I will just mention the mental health takeover that has happened at the Eastern Daily Press this week. Why do that briefly?
Well, there's several reasons. We've been running our campaign for 18 months now, and it's been very much concentrated on several elements, but a lot of it was around, I guess, what you'd call not just crisis services, but the services you might receive from the state. But there are two levels to mental health. There's the kind of more day-to-day, the well-being element, and I was keen for us after 18 months to put a different focus on our mental health watch campaign, and maybe make it a bit more kind of man or woman of the people. What can you do in your day-to-day lives?
But has it been an eye-opener? Has it brought things out that
it's been a massive eye-opener. I mean, the most positive element of it was that we had 20 plus pages full of pictures of people who were prepared to say, look, I've struggled, or I am struggling, and this is what I did about it, or this is what I'm doing about it. And as the front page said, the big message that I was looking for is you are not alone. Because I think, obviously Michael and people who work for his trust can do so much, but actually there's general day-to-day stuff that we all have a role in playing, that whether we struggle with mental health or not.
We'll get that to more in part two, but Kimberly, you were a part of that. As you say, you told your story through that. Mm-hmm. Does it encourage you that it's now being talked about in that way, the fact that it's not being swept under the carpet anymore?
Yeah, I think it's really important that we focus on the other side of it, like you say, people getting better, because I think the message that you're not alone and that it's a common thing is out there now. I think we need to move on to what the next stage of that is. People do get better. I think because of NSFT and the situation that we've been in, there's been a lot of focus on who we've lost to suicide and who've come under that care and have struggled. There's a lot of focus on that side of it, but I think it's now time to focus on the positives.
It's a really good point you made there, because I was going to make this about the report we were talking about at the start. There's lots of reports, and to be fair, we play a part in this. We've identified there's a problem. It's very easy to identify there's a problem. It's very not easy, but it's easier to do a big 130-page report and say here's everything that's wrong. The hard bit, which I know we're coming to, is actually, well, we all know that there's an issue here. What are we actually can do to change it? That's the hardest bit.
We will get onto that part too. But Tom, one last word from you. You did mention there are some places that you speak to. We're not asking you to name names where there are problems. You do see it when you go into businesses. Are there any particular horror stories you do come across about the approach that people have to it?
I think one of the common naiveties in the workplace is where you get somebody going, we don't have that problem here. Mm-hmm. And that might be an individual making that decision who's never even asked their staff what it's like to be unwell.
Especially if it's someone who's got very, I guess, I'm not sure if it's the right word, but robust mental health, who's never experienced it themselves.
I speak to hard-nosed, hairy engineers. I speak to people who are in customer services. I speak to directors who are running in research and development, running large global operations. That we're humans. That is a common denominator that we all share. Whatever you think about your boss, they are human, and people are susceptible to these things. Only 4% of people think it's work solely that's responsible for their poor mental health. It's life, it's work, it's a mixture of those things, and in a sense we share that. So it is important that we have that feeling that there is something we can do. There are positive steps you can take in work and out of work as well.
Well, Tom, we will get on some of those positive steps in part two, so that's a good place for us to leave it. After the break, we are talking more about mental health in Norfolk and what all of us can do to help improve it. Do stay with us. Welcome back. Tonight we're talking mental health in Norfolk, where the services here are starting to turn the corner and what we can all do to help improve things. On the panel tonight, Michael Scott, Chief Exec of the Norfolk and Suffolk NHS Foundation Trust, Editor of the EDP, David Powles, also with us, Kimberly Myhill from Equal Lives, who was diagnosed with depression 5 years ago, and Tom Oxley from Bamboo Mental Health. More from the panel in just a moment, but let's hear first from mental health campaigner Tasha Devon. Hear some more from her. We asked her what every single one of us can do to help someone who is struggling with their mental health.
You treat somebody who has experienced mental illness in exactly the same way as you would treat a colleague who is experiencing physical illness. So you you don't judge them, you listen to what they have to say, you ask them if there is anything that you can do, you maybe make them an extra cup of tea. It doesn't have to be a huge deal, you don't have to be a qualified expert, and bear in mind that they're not. I think so often we assume that people with mental health difficulties are going to be dangerous in some way, but there's only a very small percentage of people with mental illnesses are in any way dangerous. So you just talk to them like you would do normally and provide them with that network of support.
Now, whilst Natasha was telling us some of her advice there, Kimberly, I spotted you nodding vigorously, particularly when she was talking about extra cups of tea. It sounds silly, but a little things like that, would things like that simply have helped you if people could have dealt with things differently?
Yeah, I think there's a lot to be said for the power of the community. So outside of using natural services, if we can create an environment where we can just talk about it so freely. So that's the good thing about working for Equal Lives for me, is I can just talk to these people so bluntly and openly about it, just in the same way that I would if I had a cold. So if there's a day where I'm struggling a bit, and I just say, guys, I'm struggling a bit over here, I'm just going to put my headphones on and I'm just going to do a bit of that works massively for me. And I think.
But did you find some people maybe did clam up a little bit when you said, look, okay, this is what's going on at the moment?
I think
did some
to begin
people change?
with, but I think largely the way that our organisation is set up kind of allows that. But I think in some other circumstances, I've used the same language that I would when I'm at work, and I do get a much different response. I kind of get the awkward laugh, and then people don't know what to say. And I think I try to make a point of being so just brazen about it now that it helps the other person to relax. I think, well, if I'm open to say whatever, then they should be able to as well. So creating that flow it takes a huge pressure off, and you don't have to explain yourself. I think that the biggest thing is when you try to open up to somebody and you tell them that you're depressed or whatever else, and people ask you why. I think that needs to stop.
Well, Tom, some good advice there.
Absolutely. I think if you're a manager and you see somebody struggling, rather than go, what's wrong with you? And therefore identify that, what's wrong and go by that. You can say to them, let's go and have a cup of tea. I'm listening. Tell me about it. What's been going on? How can we work stuff out together?
And that's not patronising, that's just the way to go about it.
It may be that somebody has all the language around this, they're very comfortable and confident about talking about it, but it may be the first conversation they've ever had. They may not know what's going on. So when you're open and you give them time right there and then, not after work or at lunchtime, but I'm listening to you now. You're important to me. These are really, really positive and powerful things to do.
Yeah, well, David, you are a people manager. If someone came to you, a reporter was on the phone who was having a tough time, and they said that, how would you deal with it?
Well, it's happened, and I was going to say that is one of several reasons why we launched the mental health campaign. And I don't mind saying that it happened. There was an experience where someone came to me who was at the lowest ebb, and just basically said help, and I've just felt, looking back on it, that I didn't know how to handle that situation. That person's actually been very kind since and said you handled it perfectly, but at the time I felt out of my depth. I felt like, this was a crisis situation as well, so I didn't know who to call. We actually, not too far from here is the walk-in centre. We went there, didn't have any luck. So I just felt very, very vulnerable myself, actually, because I thought if that person had come up to me and with their leg hanging off, I'd have known straight away what to do. And really, that was a very personal experience that made me think, I wonder how many other people feel very similar to this. There were other things that kind of happened at the same time outside of that. But we've been through a journey actually here where I think that actually as a team, it's something that we've all kind of been through together because of the campaign. Because it's definitely opened a few eyes, and it's something that actually there's conversations we have around, people in the office who are not afraid to talk about it, and there's been a real change to that. And what I think is really interesting, but just to finish on, is it's just stuff by being human. It's not stuff that necessarily you can have a kind of here's 10 things you must tick off whenever someone you can't necessarily go on a special course. It's just about being human and taking yourself out of the manager situation.
This is part of the stigma, because we all know how to turn up at A&E or turn up at the walk-in, but the mental health service is not always there. And so what our job is to get into those mainstream settings where historically we haven't been. The good news is, as I said earlier, we're going to be in the A&E at the Norfolk and Norwich. We're also going to be in the walk-in centre over the road with mental health professionals. So to make it easier for people to access the care they need.
Well, Michael, that's some of the steps the Trust are taking, which all sound very positive. But where do you see the Trust going next? There have been historic problems that have been well publicised.
Sure.
Are you confident things are now turning that corner and going in the right direction?
Well, I am, because I talk to my staff all the time. We listen to our service users, as I described earlier, and they tell us we're improving. That doesn't mean we still haven't got a lot to do, but with the new services we're launching this year, we think people will see a real difference in the pattern of services locally and our responsiveness. The CQC believe we're improving as well, so I take confidence from that things are getting better.
Because we're due another CQC report. I guess that's stand by your beds.
We'll have that in the
time.
autumn. I mean, the early feedback is that the Trust continues to improve. We don't know any detail beyond that, but that's what they've given us as the headlines so far.
Okay, well, let's go to some social media. You've been getting in touch. Let's hear from Shane Brown first on Twitter. He says, easy answer to this. Don't vote for a government that cuts funding year after year and then wants a pat on the back for giving some of it back. Also, we have Alex Evans. He says, seems to me that when the subject of mental health increases and hits the news, nobody wants to talk about why more people are suffering from mental difficulties. Finding the cause and dealing with that is the only way we can stop and reverse the worrying increase in mental health issues. Money needs to be directed towards protecting and educating our children, especially the vulnerable ones. Well, I'll just pick up on a couple of points there from Alex. Tom, when it says about nobody wants to talk about why more people are suffering from mental difficulties, shed any light on that?
I think before we even get out of bed, there's money, mortgages in our life. There's all sorts of social media where we're comparing our lives to others. We've got a job to do, we've got kids, we've got schools, we've got demands, we've got so many things happening in our lives. If we were a laptop, a lot of our processes are running even before we get out of bed. And then life's challenges come and work's challenges come. And quite normally, in a standard everyday way, these can get on top of us. So, but the trouble is, that before, nobody ever talked about this. Our parents' generation didn't, their parents' generation certainly didn't. So we don't have the language in our households, we don't have the language in the workplace. And we really need to start exploring that in the way that Kimberly is in her workplace.
But I guess without having to everyone say, oh, you've been terribly brave, it should just be the way it's dealt with now.
I mean, obviously it's been a really, really nice response, but it's just that common thing of people keep telling me how brave I am about it, and it shouldn't be, I shouldn't need bravery to talk about what I've been through most of my life. So it should just be, it's not uncommon that people would go through what I've been through and others have been through, so it should just be an easy thing to open up.
But Michael, what we were pointing out there is talking about sort of dealing with the issues and maybe intervening early. Is that part of the challenge when it comes to designing the services? Because I guess priority might obviously be directed towards people in crisis point rather than stopping people reaching that in the first place.
Well, indeed, one of our key goals, though, is to work on prevention. And as Tom said, that's a society-wide. It's employers, it's workplaces, it's schools, it's everybody. But what we're doing is working with younger people in particular. So, our perinatal service, our youth service is trying to get at the root of these issues. And if you're looking for directions for the future, I would say look for Recovery College, which recognises the absolute experts on mental health are the people who have those issues themselves. And the most progress we make is where we sit down alongside those people, our staff, our service users, in the Recovery College, and we get fantastic feedback that people are taking back control of their own lives.
Michael, thank you very much. I'm afraid that is all the time we have for tonight. We could easily have sat here and carried on, but that is all we have time for. Tom, Kimberly, David, Michael, thank you very much, and for your contributions at home too. If you have been affected by any of the topics we've mentioned in today's programme, you can contact any of the organisations shown on screen now. As ever, you can follow us on Twitter to see what's coming up on future shows and to have your say at Mustard This Week. And you can watch back all our debates on our YouTube channel, Norfolk Now. Have a very good night.